So patients ask me, what can I expect when I come in for my cosmetic consultation with Dr. Campano? So essentially, it's a complimentary consultation, so please feel free to come on in. And then I like when patients will bring in a photograph of themselves 10, 20 years ago. And when I look at a patient, I don't just think of what you look like now. I think what are they going to look like in 10 years and 20 years, and try to think what's going to happen to your face. And if we do certain things, how can that improve the appearance of your face or your neck or your body, and what can I do to kind of maintain the appearance to something that you're aesthetically pleased to have as you know, when you present yourself. So our slogan is rediscover the beauty that's you. So I don't believe in, you know, doing something that looks unnatural. The way I was trained is you need to have everything be aesthetically just normal looking, so nothing exaggerated. I know that in social media and just, you know, reality TV, there's a lot of the appearance of people think of Southern California women and what they look like, but I think that you should just look like you, only better. If you're younger, only better, or just try to capture some of what you used to have. So, you know, every woman who's over 40 takes a look in the mirror, and then of course when on sale at Costco is that 10x magic mirror. It's terrible. So we obsess about every wrinkle, every line, because we can see them. But if you kind of step back and say, well, what did I look like? You know, there's a certain amount of wrinkles that are natural. You should have a little bit of smile lines. You should have a little bit of the tops of your nasolabial folds. That's just natural. And so if you look at celebrities and they have completely effaced any expression off their face, that's not natural. You want a little bit of mobility, but you also want to see if you can do what you can to minimize the wrinkles and some of the lines, and revolumize your face. If you think of your face, a lot of times it's a balloon and you deflate, so we try to inflate it. So when I talk to patients and say, oh, you need a little bit of volume in your face, they think that kind of big chubby cheek looks that's very artificial. No, I just mean think of your grandchild, think of your child and the way they look, and you want to kind of rediscover that appearance because you used to look like that too. And as a surgeon, I think that I look at it with a different type of aesthetic as maybe somebody else. And so I think, well, sometimes, you know, you can do superficial treatments, Botox, lasers, fillers, and I'm a recipient of all of those treatments. And I try to look as young as I possibly can and still look like myself. And then there are sometimes, though, after a certain age or a certain amount of tissues that descend, sometimes we need to do facelifts, neck lifts, other things like that. But I find that some patients will come to me and say, this doctor wants to do a facelift. Well, those patients are 42 years old. It's probably not necessary for a lot of patients because I'm thinking of them 10 years later when that facelift, so a good facelift is about 10 years. So I'm thinking of that 10 years later, they can come to me, and a revision surgery is difficult. They're scar tissue. So you really want to assess them long term, look at their lifestyle, see what kind, you know, if there's someone who's going to be out in the sun all the time, you don't want to say, okay, you're going to have to hide from the sun. You just have to be realistic. You can do a lot of different procedures. It can improve your appearance. Another thing is maintenance. So beauty products are actually quite important. And a lot of the over-the-counter products are helpful. Some are, some aren't. There are some really good cosmeceuticals that are coming out. We have the Dr. Campano skincare line as well, and so we try to incorporate natural green tea. And if you think about it, I can do a laser procedure or something on you that's an hour. But when you go home, think of twice a day, every day for just in a month. You're treating yourself 60 times. You need to make sure you take care of yourself. And I know that we don't have a lot of time. I personally don't have a lot of time. But every single day I wash my face. I put my serum. I put my sunscreen. Every night I wash my face. I put my retinol or my serum, whatever I'm going to use at night, and then my night cream religiously. And after I turned 25, I've not left my bathroom without using sunscreen. So broad spectrum sunscreen is essential. And I have some patients say, oh, I don't really go out into the sun. Well, you walk to your mailbox. You have these little outings. So you really should take care of yourself, if not to avoid skin cancer, which is really what you should be trying to avoid, but it's just for vanity, you know, to prevent wrinkles, the dark spots, the brown spots, all of that. So that's my aesthetic, and that's what I try to incorporate for my patients. And we try to get to know you on a personal basis, see what works for your lifestyle, and take a look at the way you look and see what. I have some patients come in, when they first come in and see me, I always give you a mirror and say, what bothers you about yourself? Because I can look at someone and I can think, oh, this stands out to me, but they're looking at something completely different. And so I give them the mirror. I have a lot of patients who initially, when they come to see me, say, I don't like looking at mirrors, doc. I just don't want, I feel uncomfortable. And after we're done, they're proud of looking at themselves, which really makes me feel great. So please come on in. It's 41301 12th Street West in Palmdale, California, 661-726-6277. You can check out my website, www.drcampano.com.